Hello,
Hi, how are you?
I'm good. How are you? My
Good.
name is Aldiana. I'm going to be your counselor today. What is your name?
Kathy?
Hi, Cathy. So today you're here for this session, and it's about 15, 20 minutes long session. Before we start, there's a couple things that I would like to tell you. It's about confidentiality. So everything that you say and that we talk about, it's going to stay with me. However, there is exception to it in a case if you show any signs of kind of like possibility of hurting yourself or somebody else, I have to report that. Do you understand that?
Yes.
And then also I need to ask for your permission to do this session. Is that okay if we proceed and I ask you questions?
Yes, that's good.
Okay. So tell me what's going on? What brought you here?
I'm just here because I need more of my Xanax. I've been been really anxious, having a lot of headaches, just kind of more irritated. I think I started to have diarrhea yesterday. So I need more of the Xanax that I was prescribed for me. And it's
Mhm.
just the one I have is all gone, so I just kind of need more.
Okay. How long you been taking Xanax?
I've been on the Xanax for a while, about 2 years. I've been taking the Xanax.
Hmm. And who prescribed that for you? Your primary care or?
Originally, yes, my primary care doctor had prescribed the Xanax for me, um,
Mhm.
because I was going through a lot with my divorce and stuff. So he thought that
I
would help me help me a little bit.
Well, yeah, I understand. That's hard. Divorce is not easy. How are you supposed to take that medicine? How you were taking it?
Kurt, how was it prescribed? She was prescribing it twice a day, in the morning and at night if needed. But right now I'm taking it like 3, 4 times a day, every day.
Oh, that's a lot. That's a lot.
Yeah, but I've been really needed in it because it's been helping me to just function every day. Like I don't do anything without taking my Xanax, so that's why I really need my Xanax.
Okay, I understand. So basically, your anxiety shoots high, so high that you can't control it. You have to take a medicine, right?
Yeah, yeah, I really need it. Like it's been my lifesaver. Like
Hmm.
before, even just dealing with the kids, I have to take it because I that's the only way I can function. So I really, really need my Xanax. If you could just, I'm not here for nothing. I don't want no drugs. I don't nothing. I just want you to prescribe the Xanax, and then I can leave.
Okay, I understand. Well, we have to talk about that you were basically overtaking it. That's not really good idea to do. You do know that
I'm not
Xanax is
trying to abuse the
benzodiazepine,
Xanax. Don't get me wrong. I'm not
right?
addicted to it. I'm not abusing it. I just need it. That's why I just feel like
Right.
that's why I'm here. So I don't want you to think that I'm trying to abuse Xanax or anything like that. But I just feel like I just need it to function.
Right. Well, I didn't really jump into conclusion and tell you that you're abusing it. I was just about to tell you about it. So basically, Xanax is benzodiazepine. It develops dependency. So I want you to think about that. If you think that you are not dependent on Xanax now, there's a huge possibility that you will be if you continue taking it as you do, more than it's prescribed. So, as you
Okay.
know, dependency not really good, right?
Okay. Ma'am, I'm not.
Hmm.
I just need my Xanax, ma'am.
I understand. Let's talk about that before life before Xanax. Can we talk about that? Before
Okay.
doctor prescribe a Xanax, what did you do before to calm yourself down?
I would go. I don't know. I would go like walking. I'll go read a book. I'll go to the gym a lot. Um, just do stuff to just keep me busy.
Is there anything that is preventing you to do that now?
I go walking, but I'm very busy. Like right now, at the time I didn't have kids. Now I have 2 kids, and I'm married, and it's just a lot going on. I'm working mom. It's just a lot. So that's why I feel like I need the Xanax now.
Yeah, I understand. Xanax is it's not a medication that you're supposed to be taking just as you wish. So we have to actually look for something else for you to help you with that, to help you calm yourself down and work with anxiety. Is there any way that we can think about maybe prescribing something else for you instead of the Xanax? I have a great idea for medicine for you.
I don't know. That have always been working for me. So I don't know if I'm really open to trying anything else.
How
And
about you try Zoloft? How about I send you home with this medicine and you take as prescribed, and you need to give some time for this medicine to work. So we can try to work towards this for you, kind of stay away a little bit from Xanax. What do you think about that? Let's give it a try.
um
Let's give it a try and see how does it work.
okay, I'll try it, but are you still
Yeah.
gonna prescribe me a little bit of Xanax?
No, not today.
Not at
Not today.
all?
No, we're not going to do that today.
Oh my goodness.
We don't want to overdo it. It's very important. Now tell me this. Are you drinking any alcohol?
No. Every now and then I'll
Not at
have a
all.
wine, but besides that, no.
Okay. When you are drinking alcohol, are you taking the Xanax during the day?
No, sometimes, not all the time.
Okay. Well, it is very important for you to know that you can't combine those two. And especially if you were taking the way you were 3 to 4 times, and then you will have possibility to go night for have a dinner with friends and you will drink some alcohol. It's very dangerous. So I want you to know that this is the reason why I cannot prescribe this medicine to you, because it's really not something that you should take lightly. It's very serious medicine. So
Okay.
I will send you home with Zoloft, and then we'll see how does that work. Okay. And then also, when you go out, do you go talk and laugh and do that kind of stuff, having fun with friends?
Sometimes I go out with my
Does
friends.
that help with anxiety? Does that help with the stress overall?
Yeah, that helps when I talk to my friends about when I go out and socialize with my friends. It helps.
That's great. So
So
let's.
did you say you're not gonna prescribe this Xanax?
No, I'm not. Mm-mm.
Why not?
No, I can't do that. No,
Not even
I
a little
can't.
bit?
No, mm-mm. We can't do that. You used everything way too early. It's not good for you to take that much. So we have to work through that somehow this time to try to wean you off of the Xanax. There's a big chance that you're going to develop the dependency. So we don't want that, right?
No, I guess.
Yeah. So I want you to do something else when you're feeling anxious. When you know that you are getting really worked up, that you're getting so anxious, I need you to do some deep breathing. I need you to go to a quiet place and calm yourself down with some deep breathing and meditation to work through your anxiety,
Okay,
right?
I can do
Instead of just
that.
go and pop the medicine in the mouth. Can we do that?
I can try.
Yeah, let's try to do that. And we're gonna in the midtime, we're gonna go ahead and get you on the medications.
Okay, I'll
Okay?
try.
All right. we're going to try work on that.
Okay.
All right. I'm sorry, I'm not going to be able to prescribe that for you today, but
Okay.
mhm. All right. So, do you have any questions for me?
No, ma'am. Thank you.
You're welcome. I'll see you next time, and we're going to work on techniques how to work through anxiety
Okay.
rather than medications.
Okay.
All right. I'll see you next time. Thank you for coming.
Thank
All
you.
right. Bye.
Bye.
Okay, now it's your
Hi, good morning.
Good morning.
Hi, my name is Abby Johnson. I'm going to be your therapist today. How are you?
I'm good. How are you?
Good, good. And what's your name?
My name is Cathy.
Hi, Cathy. How are you? Um, so you're here for we're here to do a quick 20-minute session today. And then in the meantime, I just need to kind of clarify and clear some legal stuff out of the way, okay?
Mm-hmm.
I just want to reassure you that anything we discuss will be confidential between you and I. You are my patient. I'm going to respect your wishes and desires. But there are a few things that I have to kind of make sure we disclose. I disclose to authority figures if need be, such as if you try to hurt yourself or try to hurt anybody, then I have to disclose that. And also,
Mm-hmm.
if you try to if you have any desire to want to hurt anybody else, I have to discuss that as well. Okay.
Okay.
Is it okay if we begin the therapy session and the length of time that we're going to proceed with the session?
Sure.
Okay. So let's start by you telling me what brought you here today, how and what's going on with you.
Well, I'm here for my medications. I've been taking my Xanax for my anxiety because I'm very super anxious person, and I ran out of it. So I'm here for you to prescribe that for me.
Okay, so you've been very anxious lately, and it sounds like you've been kind of over taking your Xanax a little bit more. Is that what you're telling me?
Yes, yes, yes. I'm super anxious person, and I need my Xanax, and I need you to prescribe that for me so I can leave.
Okay, so how often have you been taking your Xanax?
Um, 3 to 4 times a day.
3 to 4. And how was it prescribed originally?
I think it was one in the morning and one in the night, but I was just taking whenever I feel anxious, I was just taking it. So
Okay, and what was your dose? Do you remember?
I think I have a 0.5 milligram.
Okay, so you had a 0.5 milligram. You were scheduled to take it twice a day, but you've been taking it, what, 3, 4 times a day?
Yeah, not every day, 3, 4 times. Like sometimes if I have okay day, then I will take only as prescribed. But sometimes if I have like very stressful day, then I take it 3 to 4 times.
So what's
In a
considered a stressful day for you?
Oh, if somebody's driving me nuts, I have so many people who are driving me nuts. So I have children and they're all the time asking me for something. I have a husband, he's always needs something. And then I go to work and the people at work is driving me nuts. So it's just that kind of stress.
Okay, so how would you rate your anxiety right now? On a scale of 1 being the least anxiety, 10 being the most anxiety, how would you?
I'm super anxious now because I don't know if you're going to prescribe this for me or not.
Okay.
So my anxiety right now, it's about like 9.
Oh, that's pretty anxious. You're very anxious in anxious right now. So
Mm-hmm.
what have you done how long have you been on the Xanax?
It's been like maybe more than a year now,
So a
I
year.
think so. Hmm.
Okay. So what led to you starting with the Xanax originally?
Because I was like so anxious and getting out of my mind that my husband said, "You are crazy. You need to go get the medicine. You need to go to see your doctor." oh, you need to get to control yourself. You're so anxious. And I was freaking out that I was just like yelling around and everything. So I had to go to the doctor and get something so I can calm myself down.
Okay, okay. Prior to you being on the Xanax, what did you do to relax yourself? Because you say you've been on the medicine for a year. So before a year ago, what did you do to help relax yourself prior to the Xanax?
Well, I didn't really do much like to kind of like do something about it, but I know that if I don't know, lay down and take a nap, or if I listen to music, that helps me too. Or if I call my friend and I talk to her and we laugh, then I feel
Okay.
better afterwards.
So you're smiling. Those sounds like some stuff that you like to do,
Yeah, it really
listening
is,
to
because I have
music.
really silly friend.
And have you been doing any of that lately?
Not so much because I'm so busy. She's busy, and we just kind of like, we still talk sometimes, but not that often as we used to.
Okay. And when was the last time you took the Xanax?
When was the last time?
Yes, ma'am.
Yesterday, I think.
Okay, so you've been
No,
out of it since
2 days
yesterday.
ago. 2 days ago.
2 days,
I'm running
okay.
out.
And what have you done lately since you've been out of the Xanax to kind of help you cope with stuff?
Nothing. I'm just going nuts. I'm just very anxious, and I just don't know what to do. Sometimes I just go and drink some wine to
Okay,
calm myself down.
okay, okay. So you've been drinking lately too?
Not so much, just at night, like when I'm watching TV or something.
How often are you drinking?
Every night.
Do you feel like you need to have the alcohol all the time?
No, that I need. I don't drink a much. I don't drink a whole lot, but I just feel that helps me calm down too.
Are you taking a Xanax when you do drink?
Sometimes I take like in the evening and then I will have a glass of wine later, but I don't do like together. I
Okay,
know I'm not supposed to do that.
okay, because the mixing the two combination of the Xanax and the alcohol together is not really a good combination for you. So if you can avoid trying to do that as much as possible, okay?
Yeah.
So let me ask you this. Close your eyes for me for a few minutes. So imagine you're in like a fairy tale land. You had a magic wand in your hand and you could just change everything around from a year ago without the Xanax. How would it, can you tell me how that world would be?
I don't know. All I know is I need my Xanax right now. And this closing my eyes is not helping me.
Okay, okay. So I understand you need your Xanax, and I understand that you want me to prescribe your Xanax. But at this time, I feel like as your counselor, you have kind of overused your Xanax a little bit more than it should. So is maybe we can try other ways and other things that we can do to help deviate from you not wanting to use the Xanax as much.
Okay, I can try.
Okay. Because Xanax is, I know, I'm not sure if you know much about Xanax, but Xanax is it's a benzodiazepam, and it has a lot of side effects if you overuse it, such as agitation, increase in anxiety, agitation, headache. Have you been having any of those symptoms?
Yeah, I do.
Yeah, yeah. And that's a sign that saying that to me that you're overusing the Xanax. So at this point, how would you what are ways that you think that we can come up with to help you to not use the
I
Xanax
just
as
need
much?
you to prescribe me medicine so I can go.
Okay.
Are
And
you
I,
going to
I
do that for me?
well, not today. Today we're not going to prescribe the Xanax
Not
because
at all.
no, I'm so sorry that unfortunately we're not going to be able to prescribe it. But
Oh my God,
however,
I'm wasting time here.
I understand, and I would like to kind of help you so we can work together to figure out ways so you don't become so addicted with the Xanax. Is that okay?
Oh, I'm not addicted.
And I understand. I'm not saying you're addicted, but we want you to not become addicted to the Xanax. So
Okay.
first thing I would like for us to kind of win you off and detox you off the Xanax,
Okay.
and then find other ways that you can be able to cope with your anxiety.
Okay.
Okay. So I know being on the Xanax and being the dose, the amount that you're taking is a very high dose. So we'll have to detox you. Would you be interested in maybe going to like a detox center to be able to help you with the detox? It's just going to be for a few days.
I don't know if I can do that, but I can try other ways.
Okay. But in the meantime, while you're at the center, I will be there doing therapy sessions with you in the meantime. I'll come and see you on a regular, daily to just check base with you. And there'll be nurses there to kind of help you with detoxing. Okay. And then in the meantime, while we're doing the sessions, we can do some behavior therapies to help you better understand what behavior and things led to you initiating wanting to take more of the Xanax on a daily basis. Would that be something you might be interested in it?
Yeah, I
It's kind
can
of like a
try it.
cognitive behavior therapy model where you and I talk about and focus on the thoughts, positive and negative thoughts, and how to deviate those negative thoughts to positive thoughts.
Okay.
Okay. I think that's something we can definitely try. And then in the meantime, I'll start you on the low dose Zoloft as well.
Okay.
Okay. And then I'll send you home and I want you to practice. I know you say you like listening to music. Those are some relaxation things that you can do as well. Would that be something
Okay.
you'd be interested in?
Yeah, I can do that.
Okay, that sounds good. So in the meantime, we'll do some kind of get some lavender oil. You can put it in your water to take bath to kind of help you relax yourself a little bit. And then play some smooth music in your room or in the shower while you're taking a nice detox lavender oil bath.
Okay.
Okay.
Can do that.
Okay, so those are some things, those are some positive things that we're gonna try to work on during the course of the next couple weeks, to try to get you off the Xanax, restart another medication, and practice some relaxation techniques. Okay, how would you feel
Okay.
about us making a plan to schedule to meet next week?
Sure. We can try do that.
Okay,
Mm-hmm.
so we'll meet next week, see how you're doing with with the detox, see how you're doing with all those magical aromatherapies that you're going to try to get. Okay?
Sure.
Okay. So it's been a pleasure talking to you, and
Thank
I'll
you.
see you next week.
Okay. Thank you.
And you're very welcome. You have a wonderful day.
You too.